It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest-running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey.
Hello.
Hello. And my other partner, my work partner, DNP Carissa. Hello, Carissa.
Hello.
This is a show for people who had never listened to a medical show on the radio. If you have a question you're embarrassed to take to your regular medical provider, can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. I can't mention contractually. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. So, we have some news about PA Lydia. She got her doctorate in PA, whatever that is. So that's awesome.
Yes.
Awesome. Congratulations to her. Now, DNP Carissa, you have your doctorate.
Yes.
In, what is it? In nurse, what do you call it? A doctor of nurse practice, or what is it?
Basically, yes.
Yeah. So, PA Lydia has, a doctorate level degree in PA in being a physician assistant, but she's still a physician assistant, right? Are there things that you can do as a DNP that you can't do as a regular old NP master's level?
Not in this state.
So other states there are?
Mm-hmm.
So tell me about that. What could you do in some other states that you can't do in this state?
Independent practice.
Is that
Run
right?
My own practice.
So if you have a doctor of nursing, what's it called? Doctor of nursing practice or something, then you can actually practice independently without a supervising physician in some states. Okay. Well, hail.
What about that?
What are you doing here?
Hell if I know.
Okay, fair.
Stalking you.
Yes. I used to have a reason to be here. I don't anymore, so
Yeah. Well,
maybe the hell with y'all.
what So you're from Baltimore, and you picked up some good Appalachian lingo then. Hell with you.
I try.
So, very good. Well, so what do you know the states that allow? No, I don't either.
No.
Put you on the spot. Sorry about that.
It's fine. I think most of us just prefer to do research, and if I could find a job in that, I would be doing that.
You know what? I'm right there with you on that. If I could get paid to do research, that's what I would like to do. That's what interests me, is crunching the numbers and coming up with new knowledge. We are going to be doing a blinded, randomized trial on the Trip app pretty soon. I've already written up the proposal, and we got to submit it to the IRB, and basically it would be looking at the Trip app, TRIPP. For those that don't know, it's a meditation app. It's 10 minutes of breathing and imagery and binaural beats and all kinds of stuff that is intended to either allow you to focus or to induce a calm state. And so we're going to be using it for anxiety in the chemotherapy suite.
Wow.
And so some people will just look at a virtual image of a mountain stream, and then other people will be doing the active, the actual Trip breathing thing. So we won't be able to blind it. So if I said blinded, but it will be randomized. And we'll have a sham side to it. The patients won't know what they were supposed to get, right? So they just know that it's a virtual intervention. So that's the best way that we can sort of tease out if there is a statistically significant difference in the people who did the active app versus the passive one. So I expect there will be some improvement in people just watching a mountain stream.
Oh, yeah, absolutely.
So anyway, all right. So, I would love to do that as a job.
Same.
Yeah, anyway.
Yeah. Not me.
Not me either.
Yeah, I don't like
They're
crunching
out there,
numbers.
but they're not around here.
Yeah. Well, I have a friend who works in the pharmaceutical industry, and that's what she does. She runs clinical trials and then rolls out drugs and stuff like that. I'd rather do something a little more independent than that, but still be interesting. Do you have any topics for today, Tacey?
Of course I
Okay.
do.
So I have one that was actually sent to you, but it came to me from Natalie Tessier. And
Well, send it to me and I'll do it maybe next time.
okay. All
Yeah,
right. Well, we
unless
can do
you
that.
want to go ahead.
I
And,
was just going to go ahead and do it because it's
Okay.
interesting.
Okay.
It interests me. It's an article in the British Journal of Urology International, and the title is Depictions of Penises in Historical Paintings Reflect Changing Perceptions of Ideal Penis Size. Now, we don't know for a fact that if Da Vinci was drawing a picture of a penis on somebody, that he was actually trying to say this was their ideal size. Maybe he was like, "Ooh, this guy's got a micro penis." So there's some bias in there that we might not be aware of because we don't know the artist's intention. They didn't write out, "Hey, I'm drawing an ideal penis." They may have been actually goofing on somebody because that would be, an ancient form of trolling somebody, Well, they painted this guy in the nude, but they made his penis small. But anyway, they looked at 232 paintings. 31% were excluded because they depicted images of adolescents or an erect penis. I haven't seen any paintings with a whole lot of erect penises.
no.
Maybe Hieronymus Bosch in one of his hell escapes. But so the PDR, which stands for, what does it stand for? Penis something. Let me see here. Damn it. Why do they do that?
That's why
penis.
I-
Okay, hang on. You're right. Penis depiction ratio. Okay. Was found to differ significantly between paintings created in different centuries, with a p-value of less than 0.001, which means only one time in 1,000 would this be caused by chance. So, and then subgroup analysis revealed that paintings from the 21st century demonstrated significantly higher penis depiction ratios than paintings from previous centuries. Their conclusion was the size of the penis has gradually increased throughout the past 7 centuries, especially after the 20th century. Now, I read an article that said penises are actually getting larger in the 20th century because the average size used to be, 4.6 inches, and now the average size is, erect is 5.2 inches or something like that. But they said, it illustrates changing sociocultural inputs into male body image. But if there was actually some sort of chemical change in the environment that's causing male penises to grow, that would bias this study to a certain degree. All right? All right, Tace, are you ready?
I'm ready.
Okay, here we go.
It's Tacey's time of topics. A time for Tacey to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacey.
Hello, everyone. This week's topics are 10 strange medical practices from history.
Ooh, yay.
Ooh, yay.
Okay, I like that already.
Number 1, milk transfusions.
Milk transfusions.
In 19th century, milk was used as a substitute for blood, and that the fatty, oily qualities would become white blood cells.
Oh.
Well, that resulted in death.
Oops.
A lot.
Yeah.
One time the
because you're an
injection
idiot.
dropped the patient's pulse immediately, and they were resuscitated with morphine and whiskey.
There you go.
The patient lived 10 days.
Oh, goodness.
Wow.
Yeah, that
Number
sounds like a
2.
terrible idea.
You get nothing.
A lot of these aren't good ideas. Number 2, and we all know this, cigarettes used to be a cure for asthma. Now we know they do the opposite, but they already knew cigarettes cause undesirable effects, but they still kept saying that it didn't. They didn't, right?
I am so smart.
Yes.
They knew subjects became breathless in exertion and pains around the heart. but they still kept saying use it for asthma.
Yeah, right. This is the craziest thing. 5 out of 6 doctors recommend Chesterfields or whatever.
Yeah.
It was nuts. I remember when people were still smoking in the hospital.
Oh, yeah.
I used to make rounds at this little rural hospital, and when I first got there, which was 92, you could still smoke in the rooms. Patients could smoke in the rooms, and every about 2 a year, we'd have somebody light their oxygen tubing on fire.
Oh, no.
And it, oxygen doesn't burn, but it is an accelerant, and those things are plastic, and they just go whoop, like that, and then you end up with 2 burns going up, behind your ears, and cut it, burning your hair off and stuff. But we had this old doctor, and I loved him. He was an old surgeon. He was a tall, wiry guy, used to play football for Bear Bryant. And he would walk in holding a cigarette, on rounds. And he'd go into the nurse's station puffing on this cigarette. And then he would just sort of feebly throw it on the floor and then stomp it out with his foot right in the middle of the nursing station.
Oh, jeez.
He would go in patients' rooms to make rounds on them, and if they had a pack of cigarettes in there, he would, tap, 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 get one out there and, and
Burn one with them.
and light it up and sit there and smoke with them.
Oh, my gosh.
It was nuts.
How funny is that?
We had a
That's
cardiothoracic.
92?
Yes, we had a cardiothoracic surgeon that used to smoke in the surgery lounge up until probably, when 92, 2002. Yeah, so 20 years ago.
Oh, my God.
That's something. He was the one doing bypasses on people who had heart attacks because they smoked.
Oh, my God. That's insane.
It is. All right, Tace, go on.
Number 3, soothing syrup for babies with diarrhea to teething.
Paregoric.
25-cent cure-all full of alcohol and morphine.
Yeah.
Later on called baby killers, it was called Miss Winslow soothing syrup.
Well, they still sell it as paregoric, which is tincture of opium. So a tincture is something dissolved in alcohol. And what we find is people will prescribe it to kids for teething, and you just put it on your finger and rub it on their gums, and it does work. But you get an ounce bottle. And when you do that, you don't use anywhere close to 1/100th of it.
No.
And so when your kid is done teething, you've got a bottle that has about an ounce of opium in it. So what do? You dip your cigarettes in it. Kids don't do this at home, or their joints, and then dry them out in a dehydrator or in an oven set on low. And then, you fire them up, and you got people smoking opium in Upper East Tennessee
I thought we
in
all did that.
2023. What, Chris?
I thought we all did that.
No. Yeah, what's so weird about that?
I mean, that ruins my night. Number 4, another cure for asthma, chloroform,
Oh,
resulted in deaths of patients who overdosed during an asthma attack.
yes.
Oh, my.
We found when I was a kid, my girlfriend at the time had a house that was an old dentist's house. And he had chloroform and ether, and they were in these metal cans with a top that you could just slit the metal on the top. And so my friend Bruce saturated a rag with ether or chloroform, I can't remember which. And we were camping out at our future house. It was still being built, so it just had a deck that went off into nowhere. And he sniffed this stuff and laid down for a second and then got up and ran right off the porch. And it was like 15 feet. And we looked over there, and he landed curled around a pylon. He didn't hit it. He was just curled around it. We thought he was dead.
Oh, no.
He was totally fine because God loves drunks and idiots.
Yes. Yes.
So that was the end of the chloroform. I think we threw it in the fire, and that was fun because it's unbelievably flammable. And again, not advocating anybody do this. It was stupid as shit. A bunch of, adolescent idiots. Anyway, go ahead.
Okay, so I could have used this week with my hay fever. Cocaine.
Ah,
There you go.
Yes.
Pollen got you down. Many believed it could be alleviated with cocaine.
well, many were right. That's the thing. I talked about this on subreddit surfing today. I mean, Well, you're looking at that's what this is for, right? We're supposed to comment on these things, right?
No, I was just
I
looking
thought,
at her.
okay. I thought you were giving
I'll
me
try
the
not to look at
no,
anybody else.
No, I'm just making sure I'm not
Overstepping.
Overstepping. But I was on subreddit surfing with Vinny in Cardiff today, and one of the things that came up was when I was in medical school, we used pharmaceutical cocaine. Didn't know it. It was just blue solution. They just called it blue solution when we were doing fiber optic scopes on each other. So there's a scope called a direct laryngoscopy where you take a little tiny scope that looks like the thing they shoved up our
I was going to say, hopefully it's smaller than that.
And it's a little fiber optic scope, and you put it in the nose, and then you turn it down, and you look at the voice box, right?
Right.
Well, to numb up and to expand the airway, you would saturate these cotton pledgets with this blue solution. Then you'd shove it up the nose, leave it there for 5 minutes, and then pull it out. And then you could put it in there. It would be numb, and it would be wide open because it is a vasoconstrictor. And we did that like 10 or 12 times to each other, each time putting the cotton pledgets in because we thought that was part of the routine. And that afternoon, we were wondering why the hell rounds was just so much damn fun.
Oh my gosh.
It was nuts. We were completely blitzed out of our asses on pharmaceutical cocaine and making rounds. And to the point where a friend of mine conspired to steal a bottle of it from the lab. I'm like, dude, you did cocaine one time in your life, and you're already thinking of throwing away your whole career to go steal. Because if you get caught, that's it.
God,
You're
yeah.
out.
Yeah, sure.
So it is a hell of a drug.
It's a hell of a drug.
But apropos to what Tacey was talking about, it actually is a vasoconstrictor, just like Afrin nasal
just
spray.
like Afrin, yeah.
And it probably worked pretty well to clear out some nasal congestion. So go ahead.
Oh,
A recognized leading pathologist, George Laidlaw,
Was it
me,
Bob Loblaw?
said if you can't cure it without cocaine, you'd better keep the hay fever.
Well, fair enough.
So,
Remember Bob Loblaw from Arrested Development?
oh yeah.
And he had a law blog. So it was Bob Loblaw, blog. Anyway, go ahead.
Number 6, xenotransplantation. Involved transplantation of the interstitial gland from a chimpanzee into an 80-year-old man.
Okay.
The hope was it would return him with his physical vigor. Later, it was debunked.
Yeah. The guy that owned the radio station XERA in Mexico, that was the 1 million watt station that was right over the border, and he would transmit the Carter family from Upper East Tennessee, Southwest Virginia. They would drive down there in their jalopy, and for 2 weeks they would play in this guy's studio. And it was 1 million watts.
And
Okay?
where'd they drive to?
To Mexico.
From here?
Yes, in a
Oh,
jalopy.
my
Oh,
word.
the stories are amazing. And they would get down there and they would play in the studio, and everyone from Kansas, all of middle America could hear this radio station.
Wow.
And as a matter of fact, if you lived on the border, you could hear it in your fillings, and like on the fences would act as a diode, and you could actually hear the music coming through your
Holy
fence. It was so
cow.
powerful. But that guy was I think the goat gland doctor. He was either goat glands or monkey glands, and he did that for erectile dysfunction. And there's a famous legal case where one of America's leading attorneys, now I can't remember his name, came after him and debunked him and put him out of business. But that's crazy.
That is wild.
Yeah, let me see if I can find that guy.
That's insane.
Anyway, go ahead. Oh, yeah.
Okay. Number 7, malaria pills. Professor Julius Jauregg won a Nobel Prize in 1927 for treatment of paresis. He discovered that the condition of patients would improve after a disease that produced a fever. So after World War II popularized the use of penicillin to treat syphilis, the pyrotherapy of the malaria pills were replaced. So they give you, pills with malaria in it
Is that what they're saying?
to cause a fever?
Well, that's
To
sort
treat paresis?
of
What is paresis?
like a paralysis,
That's what I thought.
like gastroparesis is
Oh, yeah.
slowing.
Slowing.
of the-
Okay.
Slowing of the stomach. So that is kind of a homeopathic technique, is if you want to treat a fever, you give somebody something that causes fever.
Like treats like.
Right, and then you would dilute it out, and then it would somehow, the water would retain the activity.
Yeah, it's almost like the chemical imprint. The water can
Right.
somehow.
It's been thoroughly debunked, but what are you going to do?
Okay.
Yeah, that guy's name, the goat gland doctor that owned the radio station, was John Romulus Brinkley. And they called him the Kansas Goat Doctor.
I cannot believe they used to drive that far. I'd never
Isn't
heard
that crazy?
Jeez
Yeah.
Louise.
Anyway.
Number 8. This one's disgusting.
Oh, cool.
The Well Hotel. This was in 1899, a hotel in Australia for rheumatoid arthritis. When a whale died, they would row the patients out to the well. Then they would cut it up and put a narrow hole in the body. The patient would then lay in the carcass for 2 hours. It
What?
relieved soreness and inflammation. It was discovered by a drunk man who found a dead whale on the beach.
Okay, you're going to have to do that one again.
A dead well or whale?
Whale.
Oh, okay. I was thinking of a
I was
well.
in a water
Okay.
well.
Yeah.
And so
Excuse-
no,
It's
I'm
okay.
sorry. No,
It's okay.
no.
The redneck in me.
No,
It's
it's
okay.
okay. When you said well, I was thinking it was like a well we
Yeah,
had
and
in
you
the
were cutting a
backyard.
hole
Yeah.
in them and throwing them down the well.
Yeah, do that
Okay,
again.
okay.
Casey.
Now I
A
understand.
hotel in Australia for rheumatoid arthritis. When a whale died, they would row the patients out to the
Okay,
well
gotcha
in the
now.
ocean.
Gotcha.
Right.
Okay. Then they would be cut up
Say
and
sperm
put a
whale.
narrow hole in the body. The patient would lay in the carcass for 2 hours.
Like Luke in the Tauntaun carcass.
It relieved soreness and inflammation, and it was discovered by a drunk man who found a dead whale on the beach.
Huh.
Okay.
Well, there you go.
Well, yeah. Drunk men find
All kinds
of stupid
places
shit.
to lay, like ditches and cardboard and whales.
Comments, criticism?
No,
I thought it was great.
I'd like to see the double-blind, placebo-controlled study on that one.
I'm trying to think exactly how that would work, laying in a stinky well carcass.
Ooh, isn't that gross?
Well, they make perfume from whale oil. Ambergris. That's why that's one of the things that they would kill whales for.
Rude.
Yeah, it is rude. So stupid to kill this beautiful animal just to make these people smell better.
And there's a lot of other things that can make.
And
you
by the
smell
way,
better.
you still smell like shit. You just smell like shit with perfume on top of it. So.
Yeah, it's like the ones that you get into the elevator with have been smoking right before they get in the elevator.
Yeah.
Smoking like
Ooh,
a
old
fiend,
cigarettes are worse, though. I mean, if you,
Yeah.
I mean, it's just bad either
Tacey
way.
used to smoke.
Yes.
Carissa, did you ever smoke?
Yes.
So when you get behind somebody out in the open and they're smoking, do you find that pleasant? Because I do.
I do.
That's not obnoxious to me, but old cigarette smoke on the clothes.
Oh my gosh.
Like Scott said.
Oh my gosh.
Or if you do a home visit on somebody and they just smoke in the house, and it's just like, oh my God, this smell is never going to go away.
I don't know.
You don't know? You don't have an opinion about it? That's okay.
I don't like it at all.
I like it.
I do too.
Okay, so this one requires imagination, okay?
More so than living in a dead well on a
Okay.
beach.
It really does.
Okay.
It's okay.
I'm ready.
I
I'm
love
paying.
imagination.
I'm paying
Cats
attention.
in clavier. So they put cats in a row and stretch their tails out behind them.
Okay.
And then they attached a keyboard with sharpened nails set over the tails so that when you played the
they would
keyboard, the cat's tails would get punctured
Oh.
and the cats would yell. The sick
Who did
person
this bullshit?
the sick person would listen and watch the cat's faces.
What?
And that was a cure for it. Doesn't even say what
What
it
would
was
that be a cure for?
I don't know if you're
Humanity. You want to just
sick. And it
turn
had
someone into a
pictures.
monster.
It had pictures. You can look it up.
Poor little
Cats
kitty
in
cats.
clavier.
Okay, I gotta see if there's a
It's
YouTube on
Katzen
So you're,
Klavier.
Yeah.
I'm just having a hard time visualizing.
Yeah, cat organ.
cat
Yeah,
organ.
it's a cat organ. Exactly.
Oh, my God.
Oh, for fuck's sake.
Why in the fuck?
Yeah, cat organ or cat piano. Consists of a line of cats fixed in place with their tails stretched out. Now, it says here it's hypothetical. It says there's no official record of a cat organ actually being built. Thank
Okay,
God.
so this came from a Library of Congress blog. So, I mean,
well, you know, it must be true. If the government did.
I'm not saying it is. It's, dude, I got to come up with
The
something.
details
every
of the
week.
cat organ present it clearly as an instrument cat lovers might wish was a fictional horror. The instrument is used in stories which criticize the cruelty of royalty, while the piganino, a similar instrument using pigs, has been used to criticize the poor. What? Oh, my goodness.
The piganino.
We just think that life is just what we sort of experience. There's a whole lot of ways to go through this world. And some of them are really effed up.
That's a terrible idea.
Okay, here we go. The instrument was described by German physician Johann Christian Ryle for the purpose of treating patients who had lost the ability to focus their attention. That would have been me, because I had ADHD, and I was just labeled as stupid or an
Pain in the ass.
underachiever.
Yes.
'Cause
Or
I-
annoying in class.
Yes. Oh, yeah, absolutely. And just goofing around, throwing pencils.
Doesn't pay attention to daydreams.
But then I would get 99th
I still
percentile
have
on
that
the
problem.
99th percentile on the standardized test. It drove my
guarantee
parents
it.
crazy.
I guarantee it.
So they would have put me in front of a fucking cat organ.
Oh God, that would have been torturous. That would make me pay attention. I'd fake it just so I could get the hell out.
Yeah. Isn't that something?
Oh, here we go. A fugue placed on this or played on this instrument when the ill person is so placed that he cannot miss the expression on their faces, and the play of these animals must bring Lot's wife herself from her fixed state into conscious awareness. So they did it for catatonic people, or that was their idea.
Oh wow. Wow.
That's Carissa's nickname at work.
Cat.
Lot's wife. She's so salty. We call her L Dub. What up, L Dub?
Number 10,
Okay.
and I'm done.
Okay.
Smoke enemas. These were
Tobacco
used
smoke.
and were successful for cholera, used as an alternative to
they're-
opium.
They were successful.
It says successful for cholera.
Okay.
Well, I mean,
I've read about
is
this before.
No,
all
it's
the
okay.
way down to number 10. I could have gotten tired.
No.
Sometimes a pint of boiling. Oh, I can't read my writing.
Uh-oh.
Oh no.
Tobacco infused water was administered into the intestines.
Well, there you go.
Well,
So it brings new light to the term of blowing smoke up your ass.
Sure
oh,
does.
very good. Okay, first
Maybe
bell.
that's where that come from.
Yeah.
First bell of the day.
Dang it.
All right, 1827 report in a medical journal tells of a woman treated for constipation with repeated smoke enemas with little apparent success. But it does say in 1835 tobacco enemas were indeed used successfully to treat cholera in the stage of collapse. So, Tacey, you get a well.
I deserve a bell too because he
I
said
give you
I
that
was
one.
wrong.
I'll give you that one.
and
No,
then and then
Did I say you were wrong, or did I go with that? Sounds so hard to believe.
That's
But
a
if they were in
well-deserved.
the stage of collapse, the nicotine is a vasoconstrictor. These people may have been in shock, and it may have actually been acted like a pressor that we use now in the
Perked
ICU.
them up a little bit.
Yeah.
Yep.
How about it?
That's cool, man.
And that concludes our time of topics.
Yay! Thank you.
That's impressive.
All right, thanks, Stacey. All right,
Good
those
job,
very good.
Tace.
Let's. You guys want to answer some questions?
Yeah, let's do it.
Okay.
Shows
Number one
better
thing,
AIDS.
don't take advice from some asshole on the radio.
All right, here we go. Let's try. Oh, I've got one for Dr. Scott, actually.
Uh-oh. I'll have to
No,
wake up.
it's a good one, but it's a question, too.
Hey, Dr. Steve, it's Matt in Charleston.
Hey, Matt.
We got the Dr. Scott's nasal spray with CBD, and we're very pleased with it. It's been helpful.
You're that kid coughing in the background.
Yeah,
It
I
sounded
know.
like it was too helpful.
But I want to ask very
Watch it,
quickly
Dr.
if
Steve.
it is recommended for children, more specifically children around 9 or 10 years old. All right, thanks. Bye.
Okay, what do you think of that?
Absolutely. Yeah.
What?
Oh, yeah.
You're okay with it?
Oh, yeah. as tiny amount of the CBD as there is.
Okay.
But
I thought you were going to say something different to that
No.
one. That's okay.
no, gosh,
CBD is used in children.
Yes, yeah, and it's
It
very
is
safe.
the drug of choice for the Dravet syndrome, which is unremitting seizures in kids, and so it is. It has been used in children for
And
sure.
they use it topically in balms and things like that. No, I have no problem. And I'm telling you, it's a minuscule amount.
Yeah.
Yeah.
Okay.
It's just good luck getting the kid to allow something to be squirted up their
Squirted
nose.
Yeah.
Of course, at that age, they might be able to do it themselves.
Okay.
Yeah.
All right. Well, that's Dr. Scott saying
Let's
that.
talk about that Navage for a moment.
Let us talk about that. You want to tell the story?
I did not think anything of it. I was not
She was a Navage
impressed with
skeptic.
the idea at first, and I was sick this week and in bed for 2 days straight with concrete shoved up my head, and that Navage cleared it all out, and I thought there was no way, and I felt
So
50% better the next day and could breathe.
Cool.
yeah, I was
mean-
so fed up with her complaining that I went out and bought her a Navage right before CVS closed.
Yeah.
And I had some of the eucalyptus pods that Martin Hoke sent me.
Yeah.
And by the way, you remember Martin Hoke, who was on the show?
Of course,
he was
yeah.
the inventor and owner of Navage. Apparently, he sold to some investment company and walked away with bags and bags of money. So good for him. Congratulations. He was a very nice guy. Because
That's why he didn't return my email.
I know. I wanted to have him on today
Yeah.
to talk to Tacey about it so she could say what a convert she was.
Yeah.
So you want to, for the people who don't know what a Navage is, you want to just give them a brief sort of explanation of what you did.
I mean, it's this little machine. You stick a pod in there and you add distilled or purified water, not tap water.
Thank you.
And then you put it up to your nose and you turn it on, and it swishes all around up in there and
It shoots.
deposits all the gunk in the bottom.
Yeah.
And then you see it. And
So his innovation was it shoots water or the saline in one nostril and then actually sucks it out the other one.
yeah, okay, that's what. Yeah,
Yeah. So it's
Yeah.
a push me, pull you kind of
Yeah, it was-
arrangement.
yeah. And I mean, it's not the most pleasant thing to do, but I mean the risk versus the benefit is
Yeah.
amazing.
I think it feels great. And it's like a motorized neti pot.
Yeah.
Basically, that's
yeah,
what it is.
that's what it is. And it was. I mean, the difference was, I'd gone at least 24 hours not being able to breathe, and I could breathe. I mean, continuously for
Yeah.
the next couple of days after doing it.
I've done it when there are pollens in the air and I'm sneezing, and they build up in there and then they continue to react with the mucous membrane in the nose. And I found just doing a good nasal lavage will decrease the burden of antigens in my nose and make me feel better almost immediately. So it's a great thing. He should get a Nobel freaking prize for that. Stupid Navage. Anyway, check it out. I think we have them on drsteve.com. Stuff.drsteve.com. If you look down there, you can look at one. All right. Here's another one. Dr. Scott, you might be able to help with this.
Hi, Dr. Steve. This is Phil from Tampa. I'm calling because I had a question related to injuries in your legs. A friend of mine the other week, he's a painter, and he was on a ladder, and he accidentally slipped, and he, came straight down on his legs, not far. He's only, 2 or 3 rungs up, but
Yeah, it doesn't take
Doesn't
far.
take
That's
much.
the crazy thing about gravity.
The first
he
one can do it.
injured his quad muscle, tore it actually.
Ooh.
And I've heard this before. You see it in professional wrestling and stuff like that,
Yep.
where they land weird and you tear a muscle. And I'm just curious, is that something that's frequent? That can happen a lot. You take a wrong step, you come down weird and you tear a muscle.
If you're not expecting it.
Well,
So I've come off, I've been walking and walked off a curb before. Done it a million times in my life since I was a little kid. But if I didn't know it was there, that jarring, I remember I thought I had ripped a vein or an artery in my head. That's how bad it hurt. And it's like, it's not 4 inches.
Yep.
But you're not expecting it, so your body's not cushioning the blow. It's not reacting properly to that acceleration, as little as it is, and it can really hurt you. So, yeah, go ahead. You were going to talk about falls and above ground level.
Well, I was going to say too. I heard a story of a very healthy 50-year-old lady. Last step, taking her laundry into the basement to do.
Yeah.
Last step, broke her ankle so badly she almost had to have her foot amputated.
Wow.
Because it tore blood vessels and everything in there. Yeah. It was awful. But anyway, but going back to tearing muscles. Yes, you're right. If you're not warmed up, and you're not expecting that movement, you can certainly tear them. It's real easy, but the quads are tough to tear.
Yeah.
Because those quadriceps are big
tell them
muscles.
what the quadriceps are.
Yeah. So typically, what we're talking about are the big strong muscles in the front of the leg that run from your hip, run from your hip to your knee, and that's kind of what we call the thigh muscles, and they're big. But you will see this torn from the top of the kneecap.
Yeah.
And if they do that, that's typically a surgical case. They'll put that back together, which is not fun. We actually know somebody that had that recently, don't we?
Do we?
Yeah. Late diagnosis is
okay.
special.
Okay. Ding, ding, ding.
Friend.
But, the problem is bone and tendons don't have good blood supplies. They don't heal very well. And muscle, when you go cutting in it, is like the consistency of jelly, so you can't just sew it together. Now, you can sew some of the tissues around it together, but it's hard to just fix muscle. So when you reattach something like that, you've got to have a really good mechanical connection. Then you got to immobilize it so it'll heal.
Right. So we'll go back. Now, a lot of torn muscles, and one way to know that you've torn a muscle is there's usually a very large amount of blood below where the injury occurs. So if it's in your mid-leg, it'll typically drain down some, and that's a good way to know that you've torn a muscle instead of a ligament, or because ligaments and tendons don't have.
Yeah, and if you flex that muscle and you just see a sharp cutoff too.
Yeah, well, that's like in your like in your biceps, you'll see people tear a bicep, picking up something heavy, and the thing just snaps.
Yeah,
but that's normally the muscle. It's usually the tendinous attachment that just rolls down like a.
That's right,
like a shade.
Yep.
I wanted to ask you a question. So at what point in exercising, at what age would you say, and I know this is dependent on the person, but to stop jumping? Because when I was where I was exercising before, I would do jumps. My knees were killing me.
Right.
Are you talking about like jump rope?
Just
jumping rope?
Jump, like hop at the top, where you step up and you hop at the top.
High impact stuff.
And then now I'm not doing that. My knees don't hurt anymore.
Right.
Now I know I've got some weight I could technically lose.
No, come on now.
No.
And all that, but I'm thinking I shouldn't have been doing that to start with.
If we're just talking about knee pain and jumping, you can have knee pain and jumping and be as thin as a skeleton. It's not always weight dependent. It's not. A lot of times it's certainly age related, impact dependent, and padding, of course. But the other thing is and especially for females, landing when they jump, they tend to land with a straight leg.
Yeah,
which is why you'll see a lot of college and high school females tear ACLs.
Okay.
Because when they land, what happens is, especially volleyball players and basketball players, when they land, and
or cheerleaders,
or golfers or whatever, if they're jumping
golfers
up,
aren't jumping.
If they're jumping up to celebrate a hole in one, whatever.
One time in their career.
But the point being is, maybe when you're landing, your leg was just a little too straight.
Yep.
And what I like to teach people, especially young female athletes, is to land with a slightly bent leg, so slightly flexed.
Give thyself a bell.
There you go.
Hey, I finally get one. That's 2 weeks. I finally broke my streak.
If anybody gets nothing from this, but that is great advice. Always land, with
slightly
your knees
bent.
bent.
Yeah, and I think my jumping days are over.
Yeah.
I'm just a lot happier not having knee pain.
Well, and I let me talk about. I was going to say I used to run all the time. I hurt my knee. I quit running because I like walking, so I just walk a lot now instead of jogging. So maybe the same thing
is fine. But I used to like to run, and then I tore both of the
gastrocs.
Well, it was one small part of the gastrocnemius, which is the calf muscle, but I tore both of my plantaris longus muscles. And those are pretty useless, stupid muscles.
But it still hurts.
But it hurt. Oh, it hurt like an MFer, I'm going to tell you. I was laying by myself on the track and wondering how the hell I was going to get home. That's how bad it was. But, I'm concerned because I used to bodybuild, and then I got epididymitis, which is chronic pain in the top of the nut sack or the nuts. And I had to stop, and I deflated pretty quickly, and I wanted to get started again. But I'm worried that at 67, almost 68, if I started working on the curl machine, that I could actually rip my biceps because they're not. I'm going to have to really work up to it. You can't just jump back in after years of being sedentary and start doing the tough stuff. I'm just going to have to work into it. And for that, I'm going to have a trainer because I'm going to have somebody to rein me in. Because, I used to curl the max on the curling machine. And, I'm going to try to do that again.
Yes. That was not last year.
It was a long time. No, it was 40 years ago.
A little bit of water.
I was fluent in Spanish back then, too, so I lost all kinds of shit.
Dios mío.
Yeah. Anyway.
That's cool. So, so hopefully that answers your question. If it hurts, I tell people don't do it. And then ease back into it if you want to. But, finding another way to exercise is what I really am a huge proponent of.
Yeah, and don't fuck around on ladders.
No, God, ladders are the
Falling
worst.
from a ladder is a huge cause of morbidity and mortality, particularly in elderly men who think that they can still do it like they could when they were 18. And even then, they couldn't do it because they're not doing it right.
I'll tell you, Graham.
Have somebody spot you. Don't be a dumbass.
I heard recently of a 90-year-old that fell from a ladder and was injured, separated his shoulder. He had his ladder in a wagon that he was pulling behind.
Come on!
Oh, this is a true story. I just about fell over when the story was being told to me. Okay. So the ladder is he's got a ladder in this pull behind trailer on the back of his lawnmower, and it's a single axle trailer. So it's not like it's a big, car hauler trailer. Right, it's a little one that wiggles back and forth. And, of course, he gets up and he's trying to chainsaw on this ladder.
Oh, come on!
Inside this little pull behind.
And of course,
and he falls down.
Did he cut his head off?
No, thankfully, no.
I had a friend when I was in Vermont. He almost cut his head off.
Oh God!
Using a chainsaw, and it bucked back and it hit him in the neck, and he cut one of his jugular veins. And everybody was like screaming, "Chester's cut his head off." Oh. He was fine, but
that's terrible.
Yeah.
Oh man, those things freak me out.
Yeah, don't mess with. Know what you're doing. And make sure it's sharp.
Be careful, and don't do it on a ladder.
If somebody else can do it, just pay them to do it.
Yeah, there you go. That's Stacy's rule.
Exactly.
All right, let's try this one for the survivalists out there.
Hey, Dr. Steve.
Hey.
It's Jason from Louisiana.
Hey, Jason.
Got a curious question.
Okay.
What would come out the other side if you were to pee through a charcoal filter?
Oh, yeah.
Would it be pure water?
Nope. But it would not smell bad. So activated charcoal has a very large surface area. They say a gram of it's got like 30,000 square feet of surface area. And the way activated charcoal works is things are not absorbed into it. They are adsorbed, which means that they just get caught on the surface and they stick there. And so that's why you can, if you have certain drugs that someone's ingested, you give them a slurry of activated charcoal and sorbitol, and the activated charcoal will grab the drug and hold it on the surface so it can't be absorbed, and then the sorbitol make it shoot through their intestines, so they just, poop it out as in the form of diarrhea, black diarrhea. Mm-hmm. And so you can pass urine through that, and my understanding is urea is one of the things that will get caught on the surface, but the salts won't. The salt will just pass straight through, and that's the problem with drinking your own urine. It's not that it's gross because it's sterile, but the stuff that comes out the other side will lose its smell. It won't smell bad anymore because all those molecules will be on the surface of the activated charcoal, but all the electrolytes will still be in there because activated charcoal won't take that out. And therefore, really, you're still limited to that second or third pass thing. You can drink urine one time, maybe if you were well hydrated, but the second and third time, you'll start to kill yourself because you're basically dehydrating yourself by drinking hypertonic fluid. So that's why if you could do that, then people who are shipwrecked wouldn't have a problem. You just give them activated charcoal jar and have them just piss in there and they could drink it, but they can't. So if you're shipwrecked and you're out in the ocean, you want one of those stills. Have you seen that? Where you put salt water in the bottom of it looks like a kiddie pool, and then it has a canopy over it, and if it's hot enough, the salt water will float up to the canopy in the form of pure water because the salt stays behind, and then it will condense as the canopy slopes downward toward the middle into a jar where you can get pure water. So there are desalinizing devices that you can have if you're shipwrecked, but you got to have one. It's very difficult to make one makeshift. But anyway, that's kind of neat.
That's pretty cool.
But yeah, this is not really a good survival tool, unfortunately. Okay.
Good to know.
All right. Let's try. You want to do one about hiccups?
Yeah.
Hey, quick question. I want to know if you've seen in the news not about the athlete Bo Jackson, who's had hiccups continuously since July.
Yeah.
Just curious. Why?
Yeah, well, that's a good question. DNP Carissa and I see people with intractable hiccups frequently. Often it's caused by a tumor that is triggering the phrenic nerve, which is the nerve that causes the diaphragm to contract. So hiccups are just, unexpected spasm of the diaphragm. And when that happens, when the diaphragm contracts, the lungs expand and air is, inhaled into the lungs from the outside. So you get that, like that. And it could be caused by a lot of things.
Drinking. I have a friend who gets on when she drinks.
Drinking, eating, like if you eat a banana and it gets stuck on your lower esophageal sphincter, right? It would get stuck before it hits the stomach. That can trigger that phrenic nerve, and you'll get hiccups from that. And that might be a defense mechanism of trying to clear it.
Yeah, but not for 9 months.
No.
What about benzos? Sometimes, if someone's on like Valium for a long time, benzodiazepines can cause.
I'm not aware of that.
I think. You ever heard that, Carissa?
No.
Taste?
Now, they will treat them with tranquilizers, but it's not benzodiazepines.
Right.
It's phenothiazines, which is Thorazine was the classic one. But we published a paper about using gabapentin instead. And gabapentin,
low dose, or?
very low dose, 100 milligrams 3 times a day. A lot of times will calm it down. But obviously, you want to go to the source. Now, in this guy, if it's what we call idiopathic.
I got one more idea too.
Okay, yeah. If it's idiopathic, they may have to do surgery on him, and that basically the surgery consists of either clipping or ligating or paralyzing the phrenic nerve on that side. But then, of course, now you have trouble breathing because you need that to contract the diaphragm. So that's a pretty extreme thing.
What was your other idea?
Yeah, go.
Well, I was just thinking too, maybe possibly with him being an old football player, the phrenic nerve, maybe a cervical spine injury.
Yeah, could be.
Could he have some pretty bad arthritis?
And the phrenic nerve does start in the neck, so that is a possibility.
C3-ish, C4-ish.
Yeah. I would try him on gabapentin if you think it's a nerve problem. That stabilizes the nerve impulses.
Send him to me. I'll stick some needles in that neck, see if that turns it off.
Hell yeah.
I'll work on him.
By God.
I'll fix him.
Yeah, I don't know what surgery he's having and what they've tried. I don't know anything about it, but that's an interesting question.
At least there are some suggestions.
Yeah, absolutely. Let's see here. Oh, okay. This is a good one.
Hi, this is Dee from North Carolina.
Hello, Dee.
Hey, Dee.
Why is it irritating when someone else clicks a pen or opens a candy wrapper, but it doesn't bother us when we do it? I'll take my answer off the air.
That's an excellent question. The answer is negative feedback. When you snore, why don't you wake yourself up? Because the body knows it. Okay, so if I take a positive wave and combine it with a negative wave, and you combine the two together, you'll get no wave at all, right? Mm-hmm. So the brain can do that. You've heard of these noise-canceling microphones or headphones where it will listen, and then it will apply the inverse to the sound wave that is coming in, and then you get nothing. You get quiet, right? Does that make sense? Well, the brain can do that. And so when you fart and you smell your own fecal, fetid, horrific gas, it doesn't seem to bother you. If you, farting is one. Belching is another one. It doesn't seem to bother you, and lip smacking, because the brain is applying negative feedback to those inputs. And so when you're clicking the pen, the brain expects it. You get somebody next to you that's tapping their foot to some shitty song that's in their head, it drives you crazy. So that's what it is, though. The brain is able to detune the impulses that occur when you create those original stimuli. DNP Carissa, it was Magna Carta level talking today, so appreciate you being here.
I'm so glad I was here.
Well, we're glad you're here, too. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, Scott and Tacey.
Goodbye,
too.
everybody.
Hi, guys. Thank you.
All right. You want to do another couple of questions?
Oh, I've got one. I've got one from the fluid family.
What's up?
Her thing
It's
is
fine.
shorting a lot.
It is.
What is your thing?
Yeah.
Her
my thing.
duflachi, her ear.
Oh, okay. Well, here, honey.
It's fine.
No. Try these and see. I need to know if it's the cord or the plug.
The grandmother.
It's been doing it forever.
Oh, I didn't know. Here you go. Try these. Now, let me see the plug on that one that you just pulled out. Okay, yeah, so this will go in there. Those are P.A. John's shitty headphones anyway. Will you hand them to me?
His grandmother's headphones, I'm pretty sure.
Yeah, they're shit. I'm going to throw them away.
Uh-oh.
Now, those are
highfalutin.
Those are pretty expensive headphones. So
I
don't fuck it up.
them.
do you want me
Pull
to
it out?
You want me
Pull
to fix
that
it for
down.
you?
Yeah, fix it
Okay,
for
I
me.
am.
Pull it down. There you go.
There you go.
I mean, don't hand me something expensive and then tell me to fix it.
Test.
I mean, I hear you fine.
Testicles, spectacles, testicles, sibilance. I hate when they do that. Shut the fuck up. Just read something with a bunch of S's in it.
Say, sucky.
Sibilance.
Suck it.
Yeah, suck it.
Yeah, I've got So we do
Okay.
have one. We do have one.
What
for
is
the
it?
Fluid
What's
family.
the
Okay.
question?
Yeah. So Raymond.
Let's give me the Reader's
I'm
Digest,
on.
and then we'll do it.
Yeah, he's Give me two. Okay. 33-year-old can't gain weight. What could be causing it? And he is taking. He is on. Okay. I just want to be clear. He is on Depakote and gabapentin trying to gain weight.
Really?
Yeah, and he can't gain any. Maybe they can try him on. What's the other one? Starts with an L.
What?
For psychoses, makes people gain weight.
Latuda?
No, for
You're talking about Meloril?
No, gosh, no, I'll think of it 2 seconds. It's an old school medicine for bipolar and for schizophrenia.
Oh, lithium?
Lithium, thank you.
Okay.
Yeah, that can gain weight.
All right. I disagree with all these ideas.
No, I'm not. I was just
No, I
thinking
know,
of other medications that make
Yeah, I
you gain
got you.
weight. Yeah.
Okay.
Lyrica.
All right. So before we go, Dr. Scott, you've got some, or at least one question.
Yeah, I've
from
got
the
a
Fluid
question
family.
from the Fluid family. This
Okay.
is from Raymond W. 33-year-old cannot gain any weight, or muscle mass, no matter what I do, what could be causing this. And I am taking a couple medications that tend to help people gain weight, which is Depakote and gabapentin.
Oh,
yeah.
okay.
So 33 years old, can't gain muscle mass.
I wonder if those were prescribed by a licensed provider or if he's getting that off the street. Gabapentin, not classically known to cause a whole lot of weight gain.
Lyrica maybe more so than gabapentin.
Antidepressants certainly can, but I don't know. First off, I want to know why.
Yeah.
So why can't this person gain weight?
And muscle mass additionally.
Right. It could be genetic. So we'd want to look at the family tree, see if there are a bunch of tall, lanky people in there. I would want to make sure he doesn't have some genetic abnormality. Look for, changes in the chest wall that might be, suggestive of something like Marfan's or something. Something like that. I just make sure it's not genetic first.
Right.
Then number 2. Tacey will identify with this, hyperthyroidism. So if they checked his thyroid, I'm assuming that he's not type 1 diabetic, but type 1 diabetics have trouble gaining weight too because they can't metabolize sugar properly or they can't store it properly. Inflammatory bowel diseases can cause people they can eat tons of calories and they just can't absorb them. And does he have an eating disorder of some sort, But there are medications that can cause appetite loss as well. But some of those are like antibiotics and things like that. He wouldn't have been taking them for 33 years.
And the other thing is, possibly he could have just genetically low testosterone. He could have really low testosterone.
That would prevent
the muscle mass.
The muscle mass,
yeah.
Yes, that's right. So you've got your marching orders on some blood work to try. And then just stay in shape. Try build more muscle by doing cardio and all of those type of things that will build lean muscle. And then if you want to just pump some iron, that's the thing. If you want to make big muscles, you've got to exhaust the muscles. That's the key. Eat meals frequently and feel free to enjoy the high calorie foods and shakes and supplements, that kind of stuff. And they do recommend that if you can't gain weight, that you don't fill up on water. They tell us to fill up on water so we won't eat so much.
Right.
But you're going to want to have most of your intake have some sort of calories in it. Now, what I'd like to know is what's his BMI, and is he still in the
5'10".
Okay. Okay.
He did get the. Was prescribed by a psychiatrist. The medications said he did try lithium and had an allergic reaction to it.
Okay.
Yeah. Testosterone.
So he's 5'10", and how much does he weigh?
He's hasn't said that yet. 590 was testosterone.
Okay, so that's not it. Okay, I would like to know how much he actually weighs.
Yeah, and I was thinking like you also is the inflammatory bowel diseases. Just not absorbing any nutrients.
Yeah. I'd really look at if they've explored
130 pounds.
130.
Yeah.
Now I weighed 122 all through college, and I'm 5'10", or I was 5'10" then. So his BMI is 18.7. Okay, so and we don't use BMI for just any old thing, and we understand that has some flaws, but let me see if I can find. Okay, 18.5 or below is considered underweight. Okay. So he's right there.
Yep.
18.5 to 24.9 is normal, but he's right on the cusp of being normal.
I would say a couple more. If everything's normal, blood works, labs, everything's normal, I'd say in a couple of years he'll start probably packing it on like
for God's
like
sake,
the rest
yes.
of us, he'll be like the rest
Oh,
of
God.
us. How come I can't lose weight?
When I weighed 122, a scrawny little punk, which is why I started bodybuilding when, later on in life. But I would sit there at the Carolina Cafe in Chapel Hill, North Carolina, and I would get 4 eggs, toast, waffles, orange juice, hash browns, and the chef, they cooked right there in front of you. He would sit there and just watch me. Say, how do you do it? You're just packing in the calories, and you never gain a pound.
Yep.
And it's like, well, I took it for granted for so long till I hit 200, and I had these different milestones. I get to 155 and then 175, then hit 200, and that was the end of that. And I worked my way back to 175. I'm kind of stuck there right now. Do I exercise, though? No. Do I do any of the things I'm supposed to do? No. Am I intermittent fasting? Yes, except it's just because I skip breakfast, and then I don't get to eat lunch half the time.
Yeah, I didn't get to eat lunch.
It's not purposeful.
No.
Then I get home and just cram anything I can into my mouth.
In my face.
But anyway, all right, that's very interesting.
Yeah, cool. Well, hopefully he will.
Who was that?
Raymond.
Yeah, Raymond. Just email me at drsteve202@gmail.com and let me know what kind of blood work you've had and all that kind of stuff. We'll work with you a little bit on that. All right?
Yep. All right.
Okay, you want to get out of here or you want to do more? What do you
Let's get out of
You
here.
want to get out of
Get
here?
out of
Okay, we're going to play some music.
Let's do it.
All right. Well, very good. Then how about I bring up the podcast script so that I can say goodbye to everybody. Thanks, everybody, for hanging out with us. Thanks always goes Dr. Scott, Tacey, DNP Carissa. Thanks to everyone who's made this show happen over the years. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern on demand is the best way, and other times at Jim McClure's pleasure. And I'm going to have to tell you, have you seen that movie Office Space? I think I'm what was the guy's name? Melvin? No, what was his name?
Oh, the old Office Space movie,
yeah, when the guy that they just forgot about, they just kept paying him, and they didn't think he even worked there anymore.
Yes.
That I think that's me, or that's us. I want to say me. Howard Stern always does that. No, it's that's us because I don't think we have a contract right now, and they're still paying us, and I've just kept my head down, and anyway, I told Vinny, and check out subreddit surfing, by the way. It was the episode on botched surgeries. You can find it in their YouTube channel. But I said, I still like having the SiriusXM show because with it, you're not just some schlub with a podcast. And Vinny was like, so what are you saying?
Exactly.
So anyway.
Exactly.
All right. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Thank you to the Fluid family for hanging out with us. Feel free to do that any Saturday or whenever we're on. Just follow my Twitter feed or subscribe to our channel, and you can just hang out. It's like 10 people, and we all know each other, and it's fun. We don't really push the video side of this. This is a radio show. But it's fun to hang out with them. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Thank you.
Let's do the intro, and then you guys can go do whatever you're going to do. You ready? Here we go.
What did the compost say to the coffee grounds? Let's get dirty. Why did the dad love his barbecue tongs? They just clicked. Why'd the kittens get in trouble at school? They were copycats.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve.
Dr. Steve,
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider. It gives me street cred, the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my wife, Tacey, my partner in all things. Hello, Tacey.
Hello.
And my partner at work, DNP Carissa. Hello, Carissa.
Hello.
This is a show for people who would never listen to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Follow us on Twitter and Instagram at Weird Medicine, or on Twitter at DrScottWM. Visit our website, drsteve.com, for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. And please don't forget stuff.drsteve.com, stuff.drsteve.com for all of your Amazon needs. You just click straight through, or you can scroll down and see all the things that we talk about on the show, including the delightful Navage, which we'll talk about later. Go to ed.drsteve.com. That's ed as in erectile dysfunction.drsteve.com for a significant discount on the Phoenix acoustic shockwave erectile dysfunction unit. It is way cheaper than doing it at a med spa, and you don't have to have some stranger holding your jungle region while they move this probe up and down with these acoustic shock waves. It's been shown to stimulate stem cell growth in the corpora cavernosa and improve erectile function, so check it out. It's expensive. They've got a payment plan. I'm not going to lie to you, it's not cheap. And then go to Rhodie. Rhodie has something new. So Rhodie, ROADIE .drsteve.com, and you will find the new Rhodie Coach. This is a thing that will teach you how to play an instrument. And DNP Carissa, you got a ukulele recently, right?
Mm-hmm. I did.
Okay, and you don't know how to play it, correct?
Correct.
This thing supposedly will teach you how to play a stringed instrument. So they're going to send us one. So I thought either you or Scott or you guys could share it, or Tacey would be a good one because she's never played a stringed instrument.
Mm-hmm. Nope.
And it's supposed to teach you how to play.
Cool.
So,
My brother told me about this.
oh, is that right?
Mm-hmm.
Yeah, okay. So there you go. So we'll get one here directly and see how it works. I think they're not going to be released till June, but you can order one now. If you have somebody that you know that wants to improve their chops, or a kid that wants to learn how to play a stringed instrument, check out the Rhodie Coach. And then if you just want to tune your instruments, the robotic tuner is the coolest thing in the world. And they are under $150. It's a great gift for someone that plays a stringed instrument. So check it out. Rhodie, R-O-D-I-E. No, R-O... Oh, shit. Let me see. It is ROADIE.drsteve.com. Okay, I think I said that the first time, didn't I?
Yes, I think
okay.
so.
Okay, very good. Let me just make sure that works. Yeah, there we go. Okay, all right. And the Rhodie Coach is available at a discounted price for pre-purchase. All right, my friends. Don't forget Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And what else we got? Those are the big ones, right?
Yeah, I believe so.
Okay. Oh, check us out on Patreon. Patreon.com/weirdmedicine.
Of course, Patreon.
Yeah. And also, if you want me to say fluid to your mama, I'll say it on Cameo. Just go to cameo.com/weirdmedicine. All right.
All right.
Back before I was a movie star, straight off of the farm, I had a picture of another man's wife, tattooed on my arm, with a pack of Camel cigarettes on the sleeve of my t-shirt. I'm headed out to Hollywood just to have my feelings hurt. Town'll make you crazy. Give it a little time. I'll be walking round in circles down on Hollywood and Vine. I'll be waiting on a phone call at the wrong end of a broom. This town'll make me crazy, crazy as a loon. So I headed up to Nashville to become a country star. Every night you'd find me hanging out at every honky-tonkin' bar. Pretty soon I met a woman. Pretty soon she done me wrong. Pretty soon my life got sadder than an old country song. This town'll make you crazy. Give it a little time. You'll be walking round in circles looking for a country ride. You'll be waiting on a phone call at the wrong end of a broom. This town'll make you crazy, crazy as a loon. So I gathered up my savvy, bought myself a business suit. I headed up to New York City, where a man could make some loot. I got hired Monday morning, downsized that afternoon, overcome with grief that evening. Now I'm crazy as a loon. So I'm up here in the North Woods, just staring at a lake. Wonder exactly how much more of this they think this country boy can take. I ain't fished to pass the time away neath this blue Canadian moon. This town has made me crazy, crazy as a loon. Lord, this world will make you crazy, crazy as a loon. There you go.
There you go.
You've been practicing in your sleep, I
I
can
had a
tell.
little flubs in there.
I love that song.
That's a good one.
That's a good one. All right.
What else?
Hey, Corn Dip, what's up?
Corn Dip.
Is back. All right. That was, hey, not
Corn
too
Dip
bad.
is
Not
hilarious.
too bad. I like it. Of course, it's
Opie
better
says,
if we could get
Opie
somebody
says
to
to
sing.
him, "What's the deal with the corn?" And he says, "Well, we're not that uncommon. We grow in fields." It's hilarious.
Oh my God, that is pretty funny. What about? Do you remember Ripple?
Ripple?
Yep.
No. Oh yeah. Okay. What key are you playing it in?
G. If my words did glow with the gold of sunshine, and my tunes were played on a harp unstrung, would you hear my voice come through the music? Would you hold it near as if it were your own? It's a hand-me-down. The thoughts are broken, and perhaps they're better left unsung. I don't know. I don't really care. Let there be songs to fill the air. Ripple in still water where there is no pebble toss or wind to blow. Reach out your hand. Your cup is empty. If your cup is full, may it be again. Let it be known there is a fountain that was not made by the hands of men. There is a road, no simple highway, between the dawn and the dark of night. And if you go, no one may follow. That path is yours, your steps alone. Ripple in still water where there is no pebble toss, no winds to blow. You who choose to lead must follow, but if you fall, you will fall alone. But if you stand, then who's to guide you? If I knew the way, I would take you home. Da 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 da, la da 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 da, la da da, la da, la da da, da 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 da, la da da da, la da 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 da, la da da da, la da da da.
That's a good song.
I
You do that more often.
Yeah. Give or take. See, how was prom night? Did y'all do what? Was everything good? Everybody had a good time?
Yeah, they did.
Good. And you made dinner for them?
Yeah, no, we made desserts.
Oh, desserts. Okay. Where'd they go eat?
So Carissa and I made creme brulee.
Oh man.
And we made chocolate lava cake. I made a French lemon tart. Oh, and mini chocolate cheesecakes because they were all chocolate freaks. So yeah, it was fun.